Supporting health communication campaigns presented by Lara Turner through Brandman University, an affiliate of Chapman University System. Specific focus on suicide prevention as established for the CDC. Healthy People 2020's objective to improve mental health through ensuring access to appropriate quality health services. With this, the CDC has developed 3 programs for public access, which are the Be the One to Be There and Take 5 Steps to Save Lives. They've also included information on their website for preventable suicide technology packet for communities and charities to incorporate within the community. Suicide is the 10th leading cause of death in the United States. It's the 18th cause of death worldwide. It occurs across the age spectrum and is the 2nd leading cause of death in the age group 15 to 29. The estimated cost is $69 billion in the U.S. alone. It affects individuals, families, and communities. Many factors contribute to suicide, and there are many warning signs for suicide. Community involvement can prevent suicide. Prevention includes government, public health, healthcare, employers, education, media, and community organizations working together to provide services. There has been a 30% increase in suicide rates from 1999 to 2016. In 2016, 45,000 lives were lost to suicide. And of those individuals that committed to suicide, 54% had no known mental health disorder. And using the What is Suicide information video put out by the CDC, I developed a trifolding brochure for inclusion into clinics or an online access for information. The brochure notes that suicide is preventable and that there are 7 factors that communities can do to decrease risk factors for suicidality, including identifying and supporting people at risk, teaching coping and problem-solving skills to manage challenges within life, promoting safe and supportive environments, establishing activities which support connection and reduce isolation, connecting people at risk with coordinated mental and physical health services, expanding resources to individuals struggling with maintaining needs of daily living, and reducing risk of suicide in those who have lost a loved one previously to suicide. Included on this is the CDC website and media access pages. The second page notes that many factors contribute to suicide, including relationship problems, physical health problems, criminal legal problems, crisis within the past week or upcoming 2 weeks, problems with substance abuse, job financial problems, housing, or homelessness. Included are signs to watch for, because social support often is one of the first indicators of reducing risk of suicide. Individuals discussing feeling like a burden, being isolated, increasing levels of anxiety, feeling trapped or feelings of unbearable pain, an increase in substance abuse, attempting to gain access to lethal means, an increase in anger or rage, extreme mood swings, expression of hopelessness or helplessness, changes in sleep patterns either excessive or too little, talking or posting on media about wanting to die, and making plans for suicide. Suggestions for following up for someone that has been making such statements or exhibiting such symptoms, including asking them, keeping them safe, being there, helping them to connect, and following up, along with the website of where to do these support services, a 1-800 number, and the chat line put forth by the CDC. The CDC has worked with the Action Alliance to develop to Be the One to Be There and Take 5 Lives campaign, which is included and referred to in the brochure. Goals of this project is to promote education regarding risk factors for suicide, education of warning signs of suicide, education support of public involvement in prevention, information on resources for individuals, families, and community, support of reduction of the stigma related to suicide and suicidal thoughts, support programs within the community that cultivate support systems and coping behaviors, reinforce the significant impact suicide has upon the community, and advocate for support of resources that address stressors, limited support systems, and resource support for individuals at risk for suicide. Included are a list of the resources for this presentation. Thank you for your time.